Hello, this is Jane Coombs of Working Well Solutions, and today I'm going to be talking through the training program for an occupational health technician who's come into the workplace to assist the employer as a responsible person or an occupational health department to undertake health screening or health surveillance. Now I'm going to whiz quite quickly through this session, but the joy of a video is that you can stop it at any time and look at the points in more detail. So we're going to set out for this technician sitting in front of us the aims of the session, and it will be to name two pieces of legislation. They'll be able to define the term occupational health. They'll be able to list 4 types of work-related ill health and why this particular organisation needs occupational health and needs them as a technician. They need to be able to give 3 reasons at the end of this session for that. Universal hygiene measures, that's about protecting yourself against bugs and being infected by, say, Hep B, something like that, and some ways that they can protect themselves and protect the client or the patient whilst they're working. So that's the objectives of the session. Now we're going to go into the session outline. We're going to be talking to the technicians about what actually is occupational health, why have it, who are our customers within the company, because sometimes that can be a bit confusing as well, the types of health monitoring, and I think that's important to cover that because often a lot of people don't understand the different types, whether it's required by legislation, whether it's nice to do, or whether it's best practice. Talk about the whole team and where the technicians fit into the team, how they can protect themselves and their clients, other knowledge and skills that they may need to obtain that you're going to give them training on, and finally at the end the assessment. The assessment's quite a difficult subject, but it does mean that they ought to be paying attention because they're going to be tested at the end of this session on what you've been training them on. So let's look at this. What is occupational health? And I've tried to make it quite simple. If we look at the first cog that we've got there, this is the risk assessment. Employers should be undertaking risk assessments within the workplace to look at the types of risks, health risks, that people are exposed to. And the legislation that sets that out is the Control of Substances Hazardous to Health, First Aid Regs, the Management of Health and Safety at Work, noise regulations, stress, manual handling. All of these issues need to have a risk assessment, and maybe there's some others as well in this particular organisation that you could put in this heading. The second cog, and they all intermingle and they all work together, as you can see, is the health checks. Now the health checks can be to do with skin diseases, vibration, hearing checks, doing questionnaires, looking at occupational lung diseases, doing breathing tests, and fitness for tasks, making sure that people are actually fit to do the job, that they're not going to harm themselves or members of the public, and something like that could be safety critical. But it's important that you mention, as you're giving examples, issues in your particular company that would fit in there. And then absence management, quite a big cog, because that's what a lot of people see occupational health as being really instrumental in. So it can take up a lot of the work, and each company, these cogs can be bigger or smaller depending on what the issues are. But for absence management, you're looking at long-term or short-term absence, health-related poor performance, where you get management referrals, and ill health retirement. Something else which is really key in occupational health nowadays is health promotion. We are now part of public health. The workplace is seen as a good venue to actually influence public health. And here are some examples of some health promotion activity that you could undertake. But again, this should be determined by your own particular company and what the needs are within your company. And then records and information. Now, occupational health is welcomed by the workforce generally because we are professional doctors and nurses. So keeping of records and information, keeping it all confidential, our record keeping, data protection, all forms part of that trust relationship we have with the workforce, and the technician will be coming into that circle of trust, if you like, so that they can share that special place that we have with the workforce. So why have occupational health? And we've got quite a whizzy slide here. So we're looking at reducing the risk, really. That's the overall aim of having occupational health. And that's done by risk assessment and health surveillance and screening. Those are the health checks. It's a requirement by the Health and Safety Executive, industry retirement and guidelines, also employment law and legislation, and more recently for the Equality Act, making sure that people are treated fairly and equally, even if they do have long-term health issues. Types of health monitoring that you can come across, and again this will be specific to your particular company, so you can put some good examples in here. Pre-placement, that's before somebody starts, the types of health checks that we do on people to make sure they're fit to do the role and that they're not going to harm themselves or others. Health surveillance is a technical term, it's a legal term taken out of legislation, and there's the definition of that. Fitness for role, to make sure that people can do the job that they're being employed for. And health screening, this detects disease before symptoms appear, so urine testing can detect diabetes. And that's looking at personal health rather than work-related ill health, whereas health surveillance is more about activities that you do in the workplace. Then you need to explain to the technician what the roles are within the occupational health team that you're working in or within your company that you're training in. And you can talk about what the doctors do. I've just set some general headings here. These may be right or they may be wrong. It depends on what sort of company you're in, but take or leave those or add more of your own. Occupational health advisors are usually occupational health people that've got a further qualification, are usually on the third part of the register as nurses, and this is what they could do. Practice nurses, these I call them practice nurses just to define them from advisors. These are fully qualified nurses who undertake health surveillance and screening and health promotion, but generally don't have the further qualification in occupational health. There's different levels of practitioners with different responsibilities set out, and it would be a good idea to have the job roles or job descriptions within your team so that you can go into what the roles are. So what do occupational health technicians not do? And I think that's really important that you set some boundaries very, very quickly in the training. They do not give advice on general health. They do not make decisions on fitness for role. They do not discuss abnormal findings in detail. Obviously the confidentiality issue needs to be stressed quite highly, and they do not change procedures to fit an individual. And I think spending a lot of time on this particular slide is really important, and I think technicians find this quite reassuring because it sets them some boundaries to work in. So what tests, health checks do the technician do? Well, what we've got here is some typical tests that a technician can do. They may do all of them, they may do some of them, they may do others as well. It depends what you have in your particular company and the health risks involved and the screening involved. So take or add to that list as you see possible. Now we're talking to the technicians about protecting themselves, and it's really important that we go through this in real detail, talk about infection control procedures, talk about bloodborne risks of hepatitis B, thorough training. They'll be given thorough training and stress this and say that you'll be coming on to that a bit later. They won't be let loose on the workforce until you and your team are absolutely happy that they feel competent and happy to undertake any health checks that they need to do. They may have to deal with anger and aggression, so you need to give them a bit of advice on how to deal with that. They want to feel confident in what they're doing. There's nothing more scary than being faced with a patient or a client and you've got no idea why they're there and what you're supposed to do. And that happens to me even now. So for the technicians, you really want to protect them from that as much as possible. The technicians must be reassured that they'll get support at all times when they get stuck or they have a query. So you'll be giving them a named support that they can always go to, someone on the end of the phone if they're working on their own. But the support will be as they feel they need it, so it will be worked out on an individual basis. We hope they're feeling well most of the time, but they need to tell us if they're not. They need to understand the reasons why they're doing the test, because people will ask them questions. There is sometimes suspicion about what we're doing and why we're doing it, so technicians need to have a background understanding. They can't just do it mechanically, so that's one thing. Time management, they need to stick to time, and obviously that's something to do in any job, not just technicians. And they will need to make full and accurate records of assessments, and this comes into the protecting yourself, so you can always go back and look to see what's happened. Universal precaution measures, this is about hand washing, gloves, plastic aprons, correct clothing for the environment, clinical waste, and it's all about protecting yourself from infection and the next patient as well, so you don't get cross-contamination. So how are you going to go about your first person? You see, it's about introductions, greeting, it's about setting the scene really for the technician, and other things they need to do. Other knowledge and skills required. So you're going to be talking about that they need anatomy and physiology specific to an activity, trying not to frighten them off at this stage. They will have an up-to-date job description which they can look at and refer to. They'll need to have access to policy and procedures as required. And they need to be competent and feel competent to be able to do the jobs they're asked to do. They need to be familiar with the equipment to be used and documentation, and again a clinical support in case of problems arising. So once you've been through all of that, you're then going to talk about the assessment. It's going to be a short theoretical assessment, 8 questions for each assessment covered in the session content. Once they're completed, then they will be issued with a certificate of attendance, or you may decide on a competency certificate. So the next steps for the technicians is once they've passed this assessment, they will then be issued a workbook by a professional supervisor allocated within the team. They'll be given a program of learning about anatomy and physiology, and you wouldn't be able to do this all in one day, so that needs to be staggered over, say, 3 months or so. The formal training on the equipment, I believe, is probably the easiest part that technicians have. They enjoy that bit. It's something concrete they can get their hands on. They will be observed on a number of practices. We usually say 5 to 10, making sure that they're competent to do that, and they will be signed off by the supervisor. And then once they're happy and we're happy and they're competent and they understand everything, then they will be able to start their technician duties.